If you think TB just means a cough and fever, think again. Tuberculosis is a complex disease that can affect much more than just your lungs. While most people associate TB with persistent coughing, night sweats, and fever, the truth is, this infection can sometimes take a much more dangerous turn. Sometimes TB doesn't stop at the lungs. In rare but serious cases, it can travel through your bloodstream and reach your brain, causing a condition known as brain TB or TB meningitis. This form of TB is much more severe and can be life-threatening if not treated quickly. Here's what you need to know. Tuberculosis or TB is an infection usually linked to your lungs. It's caused by bacteria called Mycobacterium tuberculosis, which typically enter your body when you breathe in tiny droplets from someone who is already infected. But sometimes, the TB bacteria travel through your blood and reach your brain. This is called brain TB, or TB meningitis. So what happens then? The bacteria attack the protective membranes covering your brain and spinal cord, leading to inflammation and swelling. Brain TB causes swelling and infection in the protective layers around your brain and spinal cord. This swelling can put pressure on your brain, disrupt normal brain function, and cause a range of serious symptoms. Symptoms can start slow, maybe just a headache or feeling tired. You might notice you're more irritable than usual, or that you have trouble concentrating. Sometimes people experience mild fever, neck stiffness, or sensitivity to light, but it can get worse quickly. Think confusion, trouble moving, even seizures. As the infection progresses, you might have trouble speaking, weakness in your arms or legs, or even lose consciousness. In severe cases, brain TB can lead to coma or permanent brain damage if not treated in time. That's why it's super important to catch it early. The sooner you get medical help, the better your chances of a full recovery. But who's most at risk for brain TB? Anyone can get brain TB, but it's more common in kids, elderly people, and anyone with a weak immune system. This includes people living with HIV, those undergoing cancer treatment, or anyone taking medications that suppress the immune system. Malnutrition and living in crowded conditions can also increase your risk. If you even suspect you might have TB, see a doctor right away. Don't wait for symptoms to get worse. Early diagnosis is key. If you've been exposed to someone with TB, or if you have a persistent cough, fever, or unexplained weight loss, it's important to get checked. Doctors use a combination of tests, like brain scans, chest x-rays, and spinal fluid checks, to make a diagnosis. Sometimes they'll also do blood tests or look for TB bacteria in your sputum. These tests help confirm whether TB has spread to your brain and how severe the infection is. The good news? Brain TB is treatable. Treatment usually means 6 to